We couldn't do it if we couldn't eat.
Okay, so like I said, I wanted to speak on women's health just because I think a lot of times that we leave ourselves out. Like we're busy taking care of our husbands and our kids, and then, you know, there's just not any time left to think about us and our health. This is going to be very vague because like at school they're really teaching us that it's the basics that people forget. Like they're worrying about what kind of plastic is in their water bottle and like what kind of chemical they could be getting from this or from that, but they're not exercising or doing, taking vitamins they should be taking, or, they're dwelling on the things that, if they just did the simple things like not smoke or, something like that, it would take care of a lot of their health problems. Okay, so the first thing I wanted to talk about were the routine things that we should be doing every year. I know a lot of people use checkpoints like their birth date or their anniversary. You don't want to go to a doctor's appointment on your birthday, but schedule it the same week as your birthday. So that way you just automatically think, oh, it's my birthday, it's time for my pap smear or my mammogram. Okay, so every year we should have a checkup. And really the big things at the checkup is you need to get your height and your weight checked because you need to know your BMI, which basically that is just measuring like where you are. Are you at a healthy range of weight, or are you a little overweight? Some people are underweight and they don't even realize it. Big health issues like cancer and things like that, you might not have any other symptom other than you're losing weight and you're not trying. So, you really need to get that checked. Get your blood pressure checked, and then get some routine labs. Like get this hemoglobin A1C is to check your blood sugar. The TSH is for your thyroid, and then the CBC checks your white blood cell count and like your red blood cell count. So that tells you if you have any infections or if you're anemic. And you just want to make sure, you can even tell your doctor, I want you to print out my lab work and then just keep it in a file at home, because no matter where you go, like if you go to like an endocrinologist that is your, diabetic specialist, he's going to want all that lab work anyway, because even your cholesterol matters when it comes to your blood sugar. Also, this is a really good time to note like the issues that you've had throughout the year. You might not have your appointment till October, but in July you might say, I know towards the end of the month I get really tired. And if you write that down and say every month this is happening, you won't forget it when you go to your appointment. And then he might say, well, that's because during your menstrual cycle, like this and this is happening. So that way you get your questions answered and you don't have to call the office. Because a lot of times it's hard to get in, it's hard for them to call you back, and it's just a lot of a hassle. And I have a few handouts. This one is on breast exams, this one's on a pap smear test, and this one is the BMI chart. And I'm going to send these around so you guys can look at them. This one, you just look at your height and then your weight, and then kind of slide over with your fingers, and wherever you are, that lets you know where you are. I'll start them this way. And then any questions you guys have, I can answer in the end. But okay, so also after the age of 20, they're recommending that every woman should have a pelvic exam and a clinical breast exam. I know in our area, it's amazing the amount of women that get breast cancer. And it's happening earlier and earlier. I mean, they're in their 30s now. And so, we need to be doing these things. That one handout on breast exams tells you to do it at home once a month. Like premenopausal women need to do it 7 to 10 days after their period, because that's when your hormone levels are low and you're not as swollen. And then postmenopausal women need to just pick one day out of the month and do it then. And you just really need to be consistent, because it's when you don't notice something that is when it goes on too far. Okay, so these are the more age-specific, or this one and this one's more age-specific, but after the age of 40, every woman needs to have a pap smear and a mammogram. Every year is what the CDC is saying, but if it's, if you've never had anybody in your family have breast cancer, or if you've never had any fibroids or any problems, then your doctor may say every 3 years. So that is pretty much, talk with your physician and he'll help you decide. The mole exam, the eye exam, and the dental exam. These are also things that we need to make sure we're keeping check of. The mole exam, as soon as our kids get outside in the sun, we put sunscreen all over them, but then we don't even think about ourselves. And this is really important to do on yourself and to have your doctor do once a year. Because maybe he'll see a spot that you'll just be like, oh, well, I thought that was always there. Or, you can't see your back. So, also the eye exam is good every year. You need to get that unless you have issues. And the dental exam isn't a yearly thing. It's actually, you need a full dental exam every year, but you need a cleaning every 6 months. And, I know my dad, his dentist found his gums were pale, so that's how they figured out he was anemic. And then 3 years ago when he went to the dentist, they said, you have a discoloration in your gums, and it was throat cancer. So, they really should be doing these exams. And let me see, after age 50, colonoscopy, and everybody's excited about that. And depending on if they find polyps or not, depends on how long you can go in between. You might have one, and if you don't have any family history, they might go 5 or 10 years without making you do another one. But if they found a polyp last year, they're probably going to do another one within the next year. Also, the CDC is saying a bone density exam for women, you need to at least get that done once after 50. If you don't have any problems, you don't have to worry about it. But, if you do have something that they're saying, they can get you started on something and it can really slow the progression. Okay, so now health shots, the ones that we should worry about. Of course, the seasonal flu shot. Yearly, we should be getting this because, there's new strains all the time. This is another article that I read. People were worrying about what's in the flu shots, but, they're not really even thinking about, simple things like, drinking enough water, taking vitamin C, or, having an adequate diet, and those things fight against the flu too. But, you do need to worry about, these things are really good for you to get. This, I know Kroger gives a flu shot every year. There's different senior citizen places you can go to that give them for free. And your doctor's office, I'm sure, gets them, or they'll send you to the health department. The tetanus shot, every 10 years you need to get that. That's just, injuries happen around the home all the time, and that is just, I know there's a booster you can get like every 5 years, but normally every 10 years is what they're recommending. The pneumonia shot, that one they're just pretty much saying if you've ever had pneumonia before, get it. If you have a low immune system, like if you have something that's, like a cancer or something that's decreasing your immune system, if you were recently hospitalized, they're saying get it. If you're over the age of 65, and that's pretty much every 3 years. Some people, I heard that they're saying they're getting it every 2 years. So. The HPV and the meningitis, those are ones that are pretty much for the younger ones, but the HPV has been known to help prevent the cervical cancer, and you might have heard of it in the news, and that's recommended for under age 26. The meningitis, that is for anyone who lives in close proximity to anyone. People down here at Restoration House are probably, you don't know when you can, where you can get it from. And if you live in a dorm or you're in the military, which if you're in the military, I think they shoot you up pretty much anything. But the herpes.
If you're in the military, you don't have a choice.
Yeah, they sit here. The herpes zoster, a lot of people don't know this is out, but for anybody who has recurrent shingles is awful, and anybody over the age of 60 can get that. It just decreases outbreaks, and sometimes it, you know, it really helps. I mean, some people never have to have it again. I know there are a few teenagers that I heard of that get outbreaks of shingles, and they've got that and haven't had anything. Okay, so this next thing is about vitamins, and you know, what vitamins do we actually really need to take? They have lists and lists and lists and lists. And I just wanted to do a quick overview of what the different, you know, major vitamins are, because a lot of people don't know what they're good for. Vitamin A is good for your vision and for your skin. Vitamin B helps increase your metabolism, so it helps with weight loss, helps keep you, you know, going. And vitamin C, of course, with your immune system. Vitamin D helps with your bones, your immune system, and your brain health. And vitamin E is good for your muscles and your brain. And vitamin E is also good for healing. People over 40, that is like the big bracket that they're saying, you know, start taking your vitamins regularly and taking, you know, some of the general health ones. Okay, vitamin D, I'll explain that a little bit later, but they're finding huge things with it and dementia and Alzheimer's. So, I mean, you should at least get your vitamin D level checked and say, you know, hey, how am I on this? Men and women, actually. A calcium tablet, a multivitamin, which they're saying you need a consistent amount all day long, and we have that kind of circadian rhythm. I don't know if you guys know that cortisol is released in your body around 7 o'clock in the morning and around 4 o'clock in the afternoon, and that's what makes you hungry. So that's, you know, if you're on midnights, that's all out of whack, and, you know, you can develop problems. But they're saying half your multivitamin, take half in the morning and half at night, which with most, that's not a problem because they're huge, so you want to have those anyway. Also omega-3, that's really good for cholesterol. Baby aspirin, that's really good for heart health. And then what does vitamin D do? That one actually, some of your calcium is absorbed in your small intestine, and by taking vitamin D, that's how calcium gets in. So you have to have the vitamin D with the calcium. It ups your immune system, it decreases inflammation, which inflammation causes mutated cells, which mutated cells are cancer. And then healthy neuromuscular function, like I said, the brain, and protects against some forms of cancer. All right, so I'm ready to take questions if anyone. Thank you.